Hi, I'm Beza. Every year, health ministries across emerging markets spend billions trying to digitize their clinics. Most of those clinics are back on paper within 18 months. The WHO estimates fewer than 20% of digital health pilots in low-income countries reach sustainable scale. Uganda went as far as imposing a national moratorium on digital health deployments after accumulating hundreds of incompatible abandoned systems. And the facilities left on paper are not edge cases. They are the backbone of primary care for hundreds of millions of people. The reason is always the same. Going digital requires a software team, a deployment specialist, a terminology expert, a data analyst, someone who speaks both clinical and technical language at the same time. The clinics that need digital records most are precisely the ones that cannot afford any of these people. When grants end and the engineers leave, the clinic goes back to paper, the data disappears, the patients remain. This is not a technology problem, it's an architecture problem. TenaOS is an AI-native clinical operating system that turns natural language clinical work into standardized, reviewable, locally owned health data, with no software team, no internet connection, and no technical background required. TenaOS replaces the entire implementation team with just a conversation. A clinical officer describes what they need, Gamma 4 searches local CIL medical dictionary mapped to ICD-10, SNOMED, and builds complete validated forms and workflows. Configuration and customization that once took a skilled team weeks now takes minutes. During consultations, our AI scribe converts spoken or typed clinical notes into fully structured, medically coded encounters. And because language matters, the system operates natively in local languages like Amharic, transcribing, translating, and extracting clinical structure in a single pass. At the same point of care, clinicians get evidence-grounded decision support drawn from WHO and MSF guidelines in English or local languages, with every recommendation citing the specific evidence behind it. If it is not on the knowledge base, it does not appear. Furthermore, with TenaOS, every patient leaves with a care summary in the language they actually speak, what they have, why it matters, what they need to do, their medications, and exactly when to seek help. Since every consultation produces data coded to the same standardized dictionary from day one, faculty managers can query that data in plain language. WHO-aligned program indicators, outbreak signals, referral patterns, or any custom public health reports are generated with just a conversation. With TenaOS, configuration is a conversation. Consultations are captured, coded, and summarized automatically in any language. Decisions are grounded in evidence. Patients leave understanding their care. And for the first time, every interaction produces data public health experts can actually use from day one without a data team. The gap between clinical expertise and clinical software has been filled by implementation teams that most of the world cannot afford. TenaOS closes that gap.